All right. Good afternoon, everyone. I see people are trickling in, but we're just going to get started in the interest of time. I know this is, well, I don't know. I feel like it's always a busy time of year, but so glad you could join us this afternoon. My name is Leslie Tarasoff, and I'm a program manager at the Provincial Council for Maternal and Child Health, and I lead the Pediatric Diabetes Network portfolio. And I'm so glad you could join us here today. Just going to advance my, oops. So today we have a special Pediatric Diabetes Network webinar with the Diabetes Hope Foundation, focused on supporting youth living with diabetes through their transition to post-secondary school. And I know this topic is relevant to many of our members of the Pediatric Diabetes Network who help prepare and support youth as they're transitioning out of pediatric to adult services. Before turning it over to our presenters, I would like to begin by acknowledging my gratitude for the opportunity to work and live on this land that has been occupied by First Nations since the beginning of this time. This land on which PCMCH operates is a traditional territory of the Haudenosaunee, Wendat, and Anishinaabe peoples. Today, Toronto is covered by the Toronto Purchase, Treaty Number 13, with the Mississaugas of the Credit. Toronto is now home to many Indigenous peoples from across Turtle Island. PCMCH recognizes that Indigenous practices of health and well-being have been in place in this territory since time began and are maintained to this day. We are committed to honoring and acknowledging our knowledge on these practices. We recognize the harms and mistakes of the past and take meaningful steps towards reconciliation by building and improving relationships with First Nations, Inuit, and Métis people. Just a quick reminder, and I'm sure these days most people are familiar with Zoom and other online platforms, but if you have questions, please use the chat or Q&A, and we'll try to keep time at the end to answer any of your questions. And also a reminder that this webinar is being recorded and will be posted on the PCMCH website in the coming weeks. So if you have colleagues who aren't able to join, they'll be able to view it that way. And now I'm going to pass it over to our presenters to introduce themselves, and then pass it over to Heather to share her slides.
Thanks, Leslie, and thank you for coordinating this and everyone for joining us today. My name is Heather Miller. I'm the Executive Director with the Diabetes Hope Foundation, and I'm very excited to be here just to share some of the learnings we've had through the work that we've done with transitioning youth and their families. And my co-presenters today, I'll throw it to you first, Debbie.
Oh, you have to unmute yourself.
Sorry. Hi, I'm Debbie, and my son David is a type 1 diabetic, and he's a second-year university student.
And joining Debbie is Andrew.
Hi there, I'm Andrew. I'm David's dad and Debbie's husband. And yeah, we're here to speak to you about our experiences with this transitioning.
And last, the other Heather today, so it doesn't get too confusing for everybody, but Heather Cadigan.
Hi, everyone. Nice to be here. I'm a fourth-year university student, and I am a DHF program facilitator.
And we're also joined, Barbara Pasternakis here as well, who's the founder and CEO of DHF, who I'm sure many of you have kind of met or heard of through your work in the field. So she's also online with us today as the other Heather Miller. So if I can get to share. So we're here today to talk about supporting transitioning youth and their families living with diabetes through their transition to post-secondary school. The objectives are to understand the challenges and stressors that youth and their families face while preparing for and starting post-secondary school, learning ways that you in the clinic environment can support them in that preparation, whether you're in the pediatric system or the adult healthcare system, and also just to share some of the programs and resources that DHF has developed over the years to support youth and their families through this transition. I'm going to start just with a quick overview about Diabetes Hope Foundation, and then we're going to talk about some for the most important categories of the transition to post-secondary. So eating on campus, moving out in residence, accessing accommodations, saying goodbye to the clinic, and parents. And then throughout, we're going to weave throughout just some of the programs and resources that we've developed to support each of these areas through the transition. For those who aren't familiar with Diabetes Hope Foundation, it was launched in 1999 by Barbara Pasternak after 2 of her 3 boys were diagnosed with type 1 diabetes within a few years of each other. She followed them through the pediatric healthcare system, and then as they were getting to the point of transitioning and through seeing other families in the clinics, she realized that there was a lack of support for that important transition. So she launched the scholarship program in 1999. We've to date provided 943 scholarships to youth across Canada, so very proud milestone. We're coming up to 1,000. One of the things that was really special about the scholarship was the scholarship ceremony, where we were able to bring together all the youth who had received the scholarship. And outside of passing each other in the halls at clinics, it was often the first time that they'd met somebody else who had type 1 diabetes. And Barbara recognized the importance of that community and that social and emotional support. So working with clinics across Canada, and Barbara and her team developed a number of free programs and resources for youth with the goal of supporting them with their mental health through that transition to make sure that it was smooth. They were continuing to prioritize their health, and that there wasn't any additional stress beyond what diabetes usually gives us all. So the first thing that's probably top of everybody's mind when they're thinking about transitioning to a new space is food, if you're living with type 1 diabetes. So we wanted to start there, kind of get it out of the way so nobody has to worry about it past the beginning of the presentation, because it really is what weighs on families' minds the most. So I just wanted to start with Heather to share her experiences as a commuter student, and then Debbie and Andrew will speak to the experiences of living on campus.
Sure, yeah. So as a commuter student, I think it's really important for clinics to be able to stress how you can bring food on campus. So one thing my clinic helped me with was making sure that I had a plan for getting like a cooler to bring in my car for the whole day. Because I usually schedule my classes so I'm there from 8:30 to 4:30 or 8:30 to 6 because I work and go to school on campus. So for that, just making sure that patients have a plan for their food, maybe establishing some meal plans or food options like cold lunches that you could bring really easily with a freezer pack, things like that. For students that live on campus, it's also really important to go and ask about different meal plans. You know, if they have a celiac allergy or gluten-free, there's lots of different meal plans that they can be registered in, or maybe places that are better than others, because there's a lot of different restaurants that might have different accommodations on campus that are important to know. Another thing that I found important before going to university was refreshing on carb counting, because even though we're all used to it living at home, sometimes before you go to university, you are going to be eating different things that maybe you're not having as a home cooked meal or something like that. So making sure that you are up on that, just so when you go to eat a new thing, it's not kind of a big deal remembering, oh, how do I do this again? So even having a resource sheet, just a refresher to give out to students, I think that's important. And just encouraging students to explore other options for if they're on university at late nights, maybe emailing campus food services to find out where campus microwaves are, things like that. So if you are bringing foods from home and you just wonder, where you can store it for the day, if you have to either keep it in your car or if you can bring it in your bag from your dorm to campus, just trying to find ways that you can still eat foods that are working with your diabetes management, and having ways to do that on campus.
Thanks, Heather. Now the flip side of the family coin, I'll ask Debbie and Andrew just to share a bit about their experiences with their son, David.
Sure, because this is one of the topics that's easy to worry about, but as parents and guardians, we've needed to really learn to let it go. Because it's tempting to want to remind them about food, but we've been really trying to make an effort to talk about other things in his life and other experiences at school. But it is so easy to fall back into those patterns, and it can feel like you do want to micromanage, but we've really just had to let it go. Now, saying this, some of the things that we think about when he's away at school, cost of food is a concern. Cheaper choice. He also lives in residence and had a meal plan with some cooking options as well. So cheaper choices are appealing, but they're not always healthy. And then there's all the new routines. The whole things are just unfamiliar. So different portion sizes, different ingredients. It's not as predictable for how the types of foods that he might normally eat would affect his numbers. Sorry, that's just the bell. That's nachos are not nachos, for example, or whatever. And there's also different eating times and wanting to eat the same as friends, skipping meals. This is not uncommon for anyone starting university, but it feels like the stakes are higher. And we just hope that they adjust and just remember the tips without completely giving up or rebelling against it and forgetting about their management or micromanaging in an unhealthy way, which is why we've just tried to let it go the best that we can. Andrew?
Yeah, and actually echoing one of Heather's points, right, is learning to carb count again. I think, when you're at home and you have a routine and you know roughly how you react to different meals because they're being prepared consistently, or you have your favorites, you need to establish new routines and also learn how to carb count again. And also learn quickly, like, yeah, this is more than I originally thought, after you try it and you go high, or not enough and you go low. So I think it's really just making sure that they learn these new routines, because there's enough cognitive load being away from home, being in a new environment, being in school, to have to like do all this complex management of your diabetes. So learning new routines and finding new food that is healthy, is reasonable priced, and that it works well with your body.
Yeah, and just to kind of summarize and really hit the point home, carb counting is the one thing that through our mentorship program comes up over and over again. Both mentors and mentees have said that they didn't realize how much they didn't know until they were put in an environment where they had to figure it out on the fly. So both when they're leaving pediatric care or when they're starting with a new adult clinic, just doing a refresher on the carb count is really helpful. If you ask, they're probably going to say they've got it because their numbers have been good or they've figured it out. But like Andrew said, it's just new foods, new environments. All the basics is sort of balancing protein and fat and fiber. Please talk about pizza, because I still struggle with that. So if you have tips you can give them about pizza and sort of heavy, high fat, high protein foods, just to avoid the drop and then the spike. Any kind of tips that you can give them is great. And then planning ahead. Diabetes is kind of this constant cycle of plan, react, recover, and then plan, react, recover again. So I know, just a reminder of what a good low snack might be that might be easier to transport in a backpack than if you're putting it in your locker at school. And a really big thing to touch on is how to adjust insulin needs for cross-campus hikes. When you're running from one class at 12 o'clock to get to another class at 12:15, and you've got to go across, 3 kilometers of campus, it's going to impact your body in a different way than going up a couple flights of stairs will. So just especially for youth who aren't exercising regularly, just having that refresher conversation about exercise and how to manage their diabetes with that too. And always encourage packing a granola bar or something that they're safe to eat, just in case. And just a few resources that we have at DHF. So you're going to see these lovely faces from the Hope Connects program quite a lot, because I think it's a really impactful program that we have, where we match youth who are preparing for or in that transition to post-secondary school with an upper year student or a recent graduate. It's just an extra support in place to vent about low blood sugars, get tips about how to manage stress, and just having someone else in your corner who's not going to be asking you about your A1C or what you ate or mom and dad questions that often come up. We also recently launched our student transition planner. So we talk a lot about eating on campus in there, just some quick tip sheets that they can access. And we've recently taken our Transition in the Kitchen cookbook, which some of you may be familiar with, and put it into a new recipe blog. So the recipes are easy to find and download. They have all the carb counts and all the nutritional information there, and have been tested by our alumni. So they do taste good and they do work for students on the go for the most part. The next topic we wanted to talk about was moving out and residence. So there are people who are commuting, but a lot of students are moving as far away as they can possibly get sometimes to go away to school. And that's another thing that's unknown and needs to be figured out how to be navigated. I know there's often the fear of going low or going too high overnight. So just some tips to kind of pass on to them. And I'm going to start with Debbie and Andrew for this one to share your experiences with David going into campus.
Sure, thanks. And we also understand that it's common, these are common things. Kids move away, that parents and children, they leave home, but with diabetes, it just feels like there is that extra complications. Some of the concerns about moving away were, the new food routines, just the stress of school. They're on their own, alcohol, sleep, roommates. What if there's a sick protocol, problems with technology, what's the pharmacy? And they don't really have a new relationship with the new diabetes team. So there's less frequent check-ins, and they're 18. So as adults, our parent role is technically removed as well because they are old enough to be doing it on their own. So there's that fear, and we didn't want any old patterns to come back with that. So it's independence, but it's a scary time. So he's on his own with so many changes without the familiar team as a backup. Just to put this in very quick context, just so you know where our perspective is coming from, because there's all different ends of the spectrum. David's more middle in the spectrum, that he doesn't really want people to know that he has diabetes, but he manages it on his own, but he's not fixated with his numbers, but he does okay. Andrew, I hope you don't mind me speaking for you, but he's more of the practical with ordering and reminding, and he's very calm and level-headed with that. I have usually been a bit more of a worrier, but I'm really trying not to be fixated with numbers. And since he's been 18, I do have to say I've really let it go. And some of that was because of some good talks with the diabetes team before he aged out, and also the help with the DHF. It's allowed us to ask those questions or do things in another way. So I didn't have to ask the people who were involved. Directly, like David. I didn't have to put that on him because there were other people to talk to. What we found helpful is that it's important to encourage the parents to start early with transferring the responsibility of their T1D kids. So have them lead the questions at the clinic visits and between clinic visits, trying to release that responsibility. Encourage the youth to start ordering their own supplies and setting up check-ins for when and how it's done. I know that we have it kind of set up that he'll just text Andrew to say, I've ordered this and it's okay. So that way we feel like we're not reminding him, we're giving him that chance first. Same thing with new technology options. It's good to discuss. We found that it was very helpful to discuss before he aged out, because he was always reluctant to get a pump. And once he realized that he only had a year before he was aging out and he was losing his current team, which was absolutely fantastic. We can't say enough good things about them. That's when he decided to get a pump, which was it was a game changer for him. He decided that because he knew that he had the support of his diabetes team for that change. And he was concerned once he turned 18 that people don't know him like his other team would know him. Another suggestion might be at the clinic that to have a private talk with kids or a session for a place for them to go without any adult or anybody for those kind of sensitive issues like alcohol and drugs and other things. And that's also where the DHF can help in too, because those are the types of things they don't necessarily want to talk about with parents. And then just the same thing that we found out about the DHF because of his clinic and his team. And it was wonderful. We are so glad to be connected, because not only for parents and the resources, but also for him. And Andrew, I'll put it over to you now.
Yeah, and I think Debbie covered most of the key things. And I think that, your call out that I'm the practical, level-headed one in the family, that's always been my way. So, the most important thing for me with David was to make sure he had 100% control over everything he needed on a day-to-day basis for his supplies. And for us, our situation was easier because he didn't need to change pharmacies and he didn't need to change doctors because he's going to school in the same city, even though he went to residence. But for others, it's definitely important to get, to figure out where's the closest pharmacy, where's the closest pharmacy that's open later or 24 hours. Where am I getting my supplies from? If it's ordered from Diabetes Express, I need the login. Who's paying for it? Because right now it's still coming out of my insurance. So he knows just to, to place the order, and the payment just gets processed. So some practical things like that. And obviously the practical things then help to make it easier to deal with the more emotional roller coaster and the daily roller coaster of dealing with diabetes.
And also, just to add a little bit, if it's okay, Heather, just the importance of self-advocacy as well, to make sure that the students know what their rights are. Again, David was kind of in the middle of the spectrum, and he didn't necessarily want others to know about his diabetes. So that was definitely a learning curve for him and at school to be able to be that advocate. And with regard to residents, there's a lot of things to think about with the roommates. If he got low and the alarm goes off, if there's frequent visits to the bathroom or kitchen options, there's accommodations that can be made, and they should be looked into if possible to help kids to fit their needs. Especially with the lows at night, that was his big concern of how do you treat it if it goes off and there's somebody like right beside you and you're waking them up. So he was able to have a roommate, but also a separate room. So that was also very helpful. And then as a parent, just encourage them to make a plan of what to do in case something happens. What if it's in the middle of the night? What's the phone number you can call? What happens if there's a problem with the pump? So trying to have those backup plans ready in place so you know what to do ahead of time.
And just one last quick point is that advocacy is important, right? As parents of an adult who's going to university, we have to help our young adult to be the self-advocate. So we can't go to the university and say, you need to do this, you need to do that. We need to help him to do the advocacy. He's got to do it. He's got to put himself forward. He's got to ask, and he's got to self-advocate. And that's a hard transition for parents, especially parents who have been so involved in a type 1 diabetic kid, to let that kid become an adult and let that adult be the advocate for themselves.
Thank you both. Heather, I'll turn it over to you as the young adult who recently became the self-advocate. Just if there's anything else you wanted to add about that transition to independence.
Sure, yeah. So I think Debbie and Andrew touched on so many amazing points. I think for this, I would really recommend looking at the peer transition guide again, because for things like having sick days on campus where if the student or the parents might be worried about what to do, we have some really great resources there about what to maybe have in your dorm room, like having Gatorade or G2 on hand, just some really helpful resources like that. Again, before I went to university, there was a sick day sheet that my clinic gave me that was really helpful because I think I lost my first one when I was involved in the clinic, but it just had that calculation of, if your ketones are above 2 or 4 and your blood sugar is above whatever level, this is how much insulin you should take. I'm on MDI, so it might be a little bit different for people with a pump, but just maybe reinforcing again that resource for how to manage sick days. Going out with T1D, maybe just a reminder that glucagon doesn't work the same if you are drinking alcohol. I think that's a really important point to tell diabetics going to university, so that when they do go out, I would recommend definitely telling a friend. You don't have to be open with everyone, but maybe just having one person there who knows you have T1D. So in case anything happens, they know kind of what symptoms to look out for, or if it's a student that maybe doesn't share their numbers with their parents, maybe consider it for that night if they just wanted someone else as a backup watching out for them. And just one more thing about living on campus, I just wanted to mention some sports things and extracurriculars. So one thing that I found out in my second year was all the intramural teams that my university had. So even though school is super busy, sometimes some students might not feel like they have the time to be on one of the competitive teams. There's usually a lot of different competitive and non-competitive intramural teams. So those usually happen once a week or once every 2 weeks. And that can just be a really fun way to kind of get some activity in there. and have that part of your life fulfilled as a diabetic as well.
Thanks, Heather. And then just kind of a recap of the conversation. The biggest thing is get them connected to as many resources as possible, both on campus, through community organizations, just to make sure that if they do get to that point where they're dealing with burnout or distress or just mental health is kind of getting too heavy, they know where to turn to for that support, and both for the youth, but also for the parents and the caregivers. Because I know that once you turn 18, it's your turn to kind of drive, but the parents are still there in the driver's seat with them, and are also going through their own transition, and the whole family is going through it together. And just really hammering home the importance of emergency planning, reminding about how to identify DKA and when to access medical care for both that and if they're going low, making sure they have a contact list of others to access. So we have one available in the transition planner. Like Heather had mentioned, review sick day management, having an honest conversation with them about how to manage drinking or recreational drugs if they choose to do that. And I know that intimacy isn't really an emergency planning, but this is kind of the best place that I could find to fit it. But just having conversations with them about starting relationships. And one of the things that I hear over and over from the youth we work with is that telling people that you have type 1 when you're at university is a whole other conversation than if you're in high school or elementary school. So just reassuring them that by the time you get to university or college, people have usually matured quite a little bit. They're not in the same place they were when you were 15 or 16, and most people want to either learn more or learn how they can support. And sometimes hearing that makes it easier for people who have kept their diabetes a secret, makes it easier for them to share it with others. It doesn't have to be the entire campus, but it helps for when they're talking to roommates or RAs or friends in their class, so that when they do go out, where something does happen, they have that backup in place. And I think the block about telling people is usually about the fear of the reaction. So letting them know it's not as bad as they might think it's going to be can go a long way. Just another reminder about the Hope Connects program and our student transition planner, where we have a section about on-campus life and sort of tips and tricks to do that. We've also launched over the summer our Greater Than TUND community blog, which is written by youth who are in college and university. And it's just sort of firsthand stories. So if they're not interested in getting connected with the Hope Connects program or online support forums, it just puts a face to other kids with type 1 diabetes, where they can hear about their experiences and learn a little bit on that transition to post-secondary school and tips and tricks for them. And parents can read it too without their kids knowing that they're doing research. So it's a nice resource to have. The next topic we wanted to get into is accommodations. And I know this one can be a little bit controversial sometimes because not everybody living with type 1 diabetes identifies as having a disability. At DHF, we speak from the position of, even if you don't identify as being someone with a disability, there are supports in place on campus that can help you, because living with type 1 does make life a little bit different, and there are challenges that you have to figure out. So we always recommend just looking into what the accommodations are, learning about them, and deciding what's going to help you balance your school as well as your healthcare. Because I think what a lot of people are scared of doing is putting their healthcare first. And so they focus on exams and not interrupting anyone during exams, stress out about what that's going to look like, and then TUND gets put on the back burner, which just starts a whole chain effect from there. So I'm going to ask Heather to walk through the accommodations that are available at most universities and speak a little bit about why that's important for students with type 1 to consider.
Yeah, so I think this is one of the most important parts for me personally. In high school, I found it difficult to kind of find out what accommodations were, what I should have. But university, I found that it was really helpful having a list of what I should have before going to my student wellness or student accessibility services. Um, so there's a lot here. So one thing I wanted to go over first is that it is good to bring the more the merrier. Even if you look at these and think, oh, um, maybe my patient or my child won't need that, or even sometimes I would look at that before going to university and think, oh, do I need to ask for that? But then you never realize what you might need later on in the year, and having accommodations before something happens is always really helpful. So, just want to go over a couple that I think are really great. So additional time for tests and or exams, and assignment extensions. This is really helpful if you have any, maybe bad nights with your blood sugars or sick days, things like that. Um, Separate writing rooms. This usually happens around exam time. So this is a really stress-free one, because if you're writing an exam in the gymnasium with like 300 people from different classes and your alarms go off, you have a low, and you have to open up your juice box and granola bar, and it's just like echoing. It's great because they have a they usually have a whole separate room where you can write in it. So if you have a low, you don't have to feel that stress of, oh my gosh, am I disturbing anyone else, or am I being too loud? And that's a really important one. I think for me, even going into university, I was really scared about having a low or a high during class and having to leave in front of everyone. So just having the accommodations of making sure you're able to eat food or drink something in the class, permission to leave class. For medical reasons, universities have a lot of great stuff now, like peer note takers. So that's when you have that accommodation to leave the class. If you would prefer to leave instead of eating something in class, someone else uploads their notes to Blackboard or whatever system your university uses, and then you don't really miss anything that was in class if you maybe don't have a friend to share your notes with or something like that. So that one has been really helpful. I think another one, on-campus housing, we mentioned a bit about that earlier, having a private or shared room. Again, it's things like fear of having your roommate being disturbed by alarms, or maybe not wanting to share that part of your life. That can be a really important one for just your own personal privacy or a feeling of safety there. And time-specific exams is also another great one. I know for me, I have an accommodation that I can only take exams in the afternoon and one exam per day, which is great because I always find that stress affects my blood sugars and can kind of shoot them up high. And so having the morning to get it under control also helps to have a little bit of extra study time. And just getting ready for that exam in the afternoon, I feel like it gives me all the time I need to be able to see those lines in a straight number on my CGM. So that one's really important. Again, for having accommodations, you can usually do it through your student wellness portal, but I'd also recommend going to your profs at the beginning of the semester if the T1Ds that you're dealing with are comfortable, just because it can be really important to say, hi, like I have T1D, so if I do step out, or if you do see me on my phone, if it's like, a really small seminar room, this is what I'm doing. I'm just checking my blood sugar. All teachers that I've encountered at university are totally okay with it. They have more than likely already had students with T1D, but just maybe having that and establishing that relationship, it can help for understanding of some of these accommodations. Just looking at my points there, I think it's most of the things I wanted to touch on, but yeah, just maybe encouraging them to look at this list or research what other T1Ds have, and going into that appointment or going to your student wellness center with kind of a list of accommodations that you'd like, even if you think you'll never use them. They're really important to have there, because if you do get sick or if anything happens that you don't plan for, it's been really nice for me on a couple occasions where I've gotten sick and I've thought, okay, thank God I have this assignment extension. And thank goodness I requested that at the beginning of the term. So just staying ahead of it and planning with your student wellness team is really important.
And I think before I throw it over to Debbie and Andrew, it's really important to treat each student as their own individual, which I'm sure everyone does anyhow, because there's a spectrum of how much support they'd like to apply for. And some students are not going to want any accommodations. They've got this, they don't want to worry about it. And others who may stress out more about their type 1, or they may have more challenges with managing it. Having these accommodations in place allows them to continue prioritizing their diabetes. I know when I went to school 20 plus years ago, we didn't have this option. And so when I went into exams, I would run a little bit high so I didn't have to go low. And just there's a lot of management around the diabetes that doesn't have to happen if you have the support from the university. I think Debbie and Andrew can talk to that, because I know David's gone both routes with his accommodations.
Sure. And even before that starts, as a parent, and as a family, the timing of the transition to university is really tricky. And we knew that it would be a very temporary stress, but it was actually very, very stressful. We didn't know, like they don't necessarily know where they're going to school. They don't know where they're accepted, where they want to apply. At the same time, if they're born earlier in the year, they're already aging out from their team. So it gets really tricky because the kids who are 18 and aged out, the university applications haven't been due, and then the forms that need to be signed and filled out for certain accommodations aren't necessarily due until June or July, and then they don't know their new team. They don't necessarily know where they're going to school to know where to get a new doctor, and all of that can become very, very stressful. But yeah, we know that that's a temporary situation. But what was helpful is that there was something set up for youth who are transitioning before school starts to let them know that they can come back to the pediatric clinics for documentation or support for accommodations, because they might not have met their new team yet and they don't have a relationship with them, and they might not feel comfortable asking or know them. We understand that you all have a lot of patience and a lot on your plate, but just knowing that was available relieves so much stress to parents and kids. Just knowing that those options, that there is that help for that small transition time between 18 and when after school starts. We were very, very thankful for our diabetes team that we had with David for that. And speaking of that, with accommodations, initially he was not interested in accommodations. He thought that he knew what he needed, but then we went to a seminar anyway before, and it was hosted by the university in the spring before school started. Each university can be slightly different, but they actually used diabetes as an example. So then we know that it's acknowledged, and it was acknowledged as something that was legitimate. David was pretty private about people knowing, but he thought he could figure it out without the accommodations. But the advice he got was, it's better to apply. It's better to be in the system. It's better to have it as a backup instead of not using it and then trying to solve the problem later. But the window to sign up and fill out the form is before the classes start. Even know what types of exams they're going to be, but it's better to just do it just in case. It's better to be proactive. Students are in the system, but that doesn't mean that they need all the accommodations all the time, but it was very helpful. He was very concerned as well about getting a low in an exam, and he was very thankful. Without going into details, he was very, very thankful to have the accommodations in a couple instances, and he does not regret signing up for them at all. He doesn't always need to use them, but just knowing that he's in the system, knowing that it's a backup, it just makes a better start for everything, especially when the university is advocating for that. But it was the forms and filling out the forms, the same thing with residents and filling out those forms, that the time period got to be quite tricky, and it was pretty hard to navigate. So on top of all of that, that at university, the students do it all themselves as well. So it's up to them. So as parents, we just try our best to support our kids with their decisions and let them take the leads on setting things up. Andrew?
I think you covered it. I think that's the key for me was, David has to do the actions. David has to step up and ask for accommodations or fill out the forms, or talk to his new team or old team or whatever. He's got to do it. So we quietly encouraged him behind the scenes and explained, is there anything we can do to help you? Do you want us to drop a form off or something like that? We can do something, but it is really, he needs to be in the driver's seat.
Thank you. So just a reminder, some of the clinic supports encourage students to consider what accommodations will help them to balance both their school and their health. Work with them to complete the necessary paperwork. It changes from school to school. Some need a letter from a doctor or a clinician. Others have a form that you need to fill out. DHF is there as a support if you're not sure how to answer some of the questions. For most students, the accommodations will never be used or may never be needed, but having them there, like Debbie and Andrew and Heather all said, reduces that stress. And just directing parents parents and students where to get access to that, because a lot of students don't know those accommodations exist for them because they're living with type 1 diabetes. So just raising it in the clinic and letting them know that you support that is really important. We have our online transition guide. So for those who have been in the clinics for a while, you probably have the phone book size version of this. We've moved our transition guide online. It has information about every public college and university across Canada. So you can use that as a space to find the accommodations. We're going to be uploading the individual school info sheets to our website in the next week or so. So I know a lot of clinics like to print that out. So please continue doing that so students have the information of who to contact about accommodations and why. In our transition planner, we walk through how to set up those accommodations and also how to advocate for yourself on campus. And then we also have through our transition hub on our website, a series of webinars that talk about how to access accommodations as well as other transition topics. And the last thing we wanted to sort of touch in on was saying goodbye, not necessarily to parents, but to the pediatric clinic, because you're there at a very difficult time in families' lives to support them through the diagnosis and adjusting to the new life and the grieving process and all of that. And so that transition to adult care can be a little bit jarring sometimes, and there's a sense of loss that comes with that. So I just wanted to get Debbie to speak to this a little bit because she really speaks about it very beautifully, about the importance of addressing this and talking about this with your families as they prepare for that transition out.
Sorry, Heather, the bell was just going off here. I couldn't hear. Did you want us to start with that? I couldn't
Yeah,
hear.
I threw it to you, Debbie.
Sorry?
If you want to start, Debbie, yeah, that'd be great.
Sure. Okay, sorry, I just couldn't hear with the bell. Yeah, it's really hard because it's the loss of the relationship and the support when the kids transition out of pediatric care. The teams mean a lot to families. I'm going to get emotional here, but you really do. It's a big impact that you have. Anyway, but then even when we just go, there's just subtle things about going into the clinic of just seeing the pamphlets up on the wall of different things that are going on, or events that might be coming up with certain emails or things, or even we were just talking about not knowing about the new technology, like David's Dexcom is up for renewal, and we're like, oh, normally we would ask for advice of what's your suggestions of what's coming up. But he does have new people to talk to, but it's not quite the same yet because that relationship isn't there yet. And then also post-secondary is also quite transitory anyway. So many aren't invested in the new team as well to the same way. But helping family through these transitions is important, that not just for the students, because it's also stressful for parents to age out, because we've gone from helping our child and supporting them and having a team to all of a sudden they're on their own. And this is natural. It's a natural part of life. But the worry just doesn't go away. Even though they age out, there just sometimes feels like there's higher stakes with diabetes. Even just thinking about some of the things that I feel like we've really let things go, and just questioning of whether we should to this extent, it is kind of even hard to talk about. But the relationship does shift. And sometimes we do think about what about us, which is a common empty nester syndrome, but it's also something with diabetes. There's just that added layer because there was just so much involvement before. And the personal relationships can be hard to say goodbye to, especially when the teams have gone above and beyond for you. We really do appreciate you. So just talking about, even if you talk about the parents about letting go, but also encouraging them to support their child and just following the lead. Something else that might have been helpful is like almost like a resource list or FAQ questions of things to consider before they age out, like 6 months to go or 3 months to go, or what happens after, of kind of like a checklist of things that we should be doing or looking forward to, because you are all so familiar with how the system works that it's second nature to you. And for us, it's the first time, and it's new, and it's overwhelming, and it's big, and we don't know what we don't know. And it's also not just for people entering post-secondary, but for people taking a gap year as well, or not attending post-secondary as well. There's a lot of changes that can happen. So even if there is some type of Q&A list or resources, have you considered, have you thought about, that could be very helpful. Things like, optometrist visits, when to go to the emergency versus versus trying to do things on your own. Just those types of refreshers that Heather's had talked about earlier. Just when they are transitioning to adult care, that there's still that backup for students, but it's tricky. Andrew, if you don't mind, you can maybe speak to the disability credits and those types of things as well. But before I pass it over to Andrew, just know that that you're missed, and even if they don't always show it. The students, I know David on one of his last appointment had flowers, and I'm like, oh, for me? And they're like, nope, for my team. And just the thought that he on his own wanted to do something like that spoke volumes. But you have a lot of patience, and we do also value your time, and it's hard because time is limited. Maybe something that you could consider is that it is tough that if your clinic does do the little beads or the certificates or something, families maybe have sometimes earned it for kids who have been there so long for just saying goodbye and leaving, because you do make a difference. And I did want to thank again that our clinic introduced us to the DHF, which is a wonderful resource. It's a fantastic resource that helps them set up for the future. So it really does help with that transition.
Yeah, and I will speak more practically about things, but that, I echo Debbie's feelings. Like it is a tough time when a kid gets diabetes, and the team is critical for the family. So, I'm getting a little emotional too. But on the practical side, the team took care of a lot of things, helping us to schedule these appointments, making sure things got done and happened. And, we had plans for things. It was always being driven by the team. And as we go into adulthood, there's a little bit of a philosophy change, right? It's up to the adult, i.e. the young adult, the 18-year-old, to make sure that they've got appointments set, that they are setting up an optometrist appointment, that they're getting their blood tests done, before they have their next doctor's appointment, that they get their new prescriptions from their new doctor. Like, it's all on them. And with the transition and all the stuff going on with school, it is a lot of load, a lot of changes. And so, again, it's not something that you necessarily, as the pediatric clinic, can do, except anything you can do to help prepare them for those things. Like I like the idea of like the 6 month, 3 month, right here, as you're getting closer to aging out, be prepared. These are some of the things you need to do. And I think DHF has a lot of resources that can also support that. But yeah, it's, and then just the one last note, we're also still not fully transitioned. And what I mean by that, yes, we're transitioned off the pediatric team, but because David is still in school, we still have, insurance things that are covered under my insurance. We have the Ontario assistive devices program is still, the money's still flowing to me, and I'm still paying for that. At some point it transitions to David, but I have no idea. That's one of the things that's on my list to research. When does that happen? How does that happen? And yeah, like the things that Debbie mentioned, the Dexcom subscription and insurance payments, and making sure that, while he's a student, he's covered, but then he switches, to his own insurance. These are all things that we are still transitioning with David. We're not fully out. And again, as parents, we'll never be completely out. Of course, we still care about him and care about his health.
Thank you, Andrew and Debbie. Heather, did you want to add to that?
Sure, yeah, you both made such amazing points, and that was so touching to hear from a T1D. But yeah, just a couple things that I wanted to emphasize. I think in my experience transitioning to the adult clinic, it can be kind of worrisome. You don't really know what the environment is going to be like, and it is a bit of a different dynamic, rather than having a team. Usually can meet with one or two people, and then maybe your endocrinologist not as much. So I think just for clinics to emphasize the 3 month or 4 month rule of having appointments before they go to the adult clinic, because I know that it's not as enforced when you move to the adult clinic, for some to have those appointments all the time, and it can be easy to not have appointments as much. But I think that it's really great to just stay up on new technology by going to appointments. And for me, I definitely find it helps to keep me accountable, knowing that I'm sharing my numbers with my adult team or endocrinologist, just to have that feeling that my diabetes is still being supported and for exploring new technology options. I also think it's important to let them know that there might be changes in their diabetes management going to university or college, and that it doesn't hold them back, but there are some things that they might have to handle differently. So for schedules, I know in high school, you're usually at school every day from 8:10 to 2:30 or whatever your schedule may be, but in university you might have one whole day of classes and then no classes and then 3 hours and going back home. So I feel like that was one thing that really affected my sugars. I didn't really have that routine as much, and so just letting them know that um, there might be some things that they have to additionally prepare for with diabetes, to just be mindful of that when they're starting off, because that first month can sometimes be a bit stressful. Um, and I think it's also important to encourage, yeah, resources, any diabetes clubs. Most universities have them now, so that's a really cool way to be a part of a diabetes community while you're in post-secondary, as well as some DHF resources and the mentorship program. I can say I knew one other student in my high school that had T1D, and we worked at a grocery store together, and that was kind of the only person that I knew that had it, and we didn't talk too much because he was a year older, and um, but it was really cool because when I found out about DHF's resources, I was enrolled in the mentorship program, and I was matched with someone who had diabetes, and that was honestly life-changing. It was so cool to be able to talk to someone else who was in the same program as me, education, and be able to just connect on so many levels about, struggles and education, or maybe things that we both worried about because we are both going on to be teachers actually. So, just having people to relate with, even through webinar programs or mentorship programs, I really cannot emphasize it enough. And I remember I even went into it thinking, oh, I don't need a mentor. Like, maybe I'll just try it for fun because I think going into it, I think, oh, my pediatric clinic has told me everything, but it's not about diabetes care management. It's about literally just having a friend that has diabetes and being able to connect with a whole other network of people that know exactly what you're going through. Um, and that's just really important, I think, to have that social connection, especially when you go to university and you might not be as closely connected with your pediatric team or your family. So having someone there or knowing where to go when someone might need those extra T1D supports is really important. So yeah, I just wanted to emphasize that. And I think Andrew and Debbie made so many other amazing points there as well.
Thanks, Heather. One thing I also just wanted to kind of bring down the love fest a little bit, so I'm sorry for that. But also just for when students are preparing to move to the adult clinic, just let them know that it's going to take a while to get to know their team. Like Debbie said, like it's about building that relationship. And I know that a lot of the youth we work with, they get to their adult clinic and it's done differently, and they just can't manage that, or they don't want to deal with that, so they stop going. So just encouraging them to give it time and give it 3 or 4 appointments before they decide that they absolutely hate it. And encourage them to go even if they forget their blood work, just to get into that habit. And you can get the blood work done after as like a worst case scenario, but just alleviating some of that stress around it, because it's really about building those routines and getting connected to those clinics, and building those relationships, which takes time to do. I just wanted to highlight the Pep Talks Caregiver Program because I know Debbie and Andrew did a great job of sort of explaining the challenges for caregivers. So we have monthly webinars that we offer for parents of youth who are in high school and preparing for that transition, just talking about moving to interdependence and shifting responsibilities. So if you watch out for our social media, you can learn more about that. And just final thoughts, just to make sure that you're reminding youth and their families that type 1 doesn't stop them, but they do need to plan for it and think about it. And one of the diabetes educators that I spoke with about a year ago framed it as they're the hero of their own story. So if you're able to import that on them, then I think it's a really nice way to look at your diabetes, that you're managing that yourself. And I'll stop there and can share some of the resources through an email afterwards if that's good.
Thank you so much, Heather, Debbie, and Andrew. And I feel like I was getting emotional there, and I have the privilege of working with so many of the pediatric diabetes care providers through the Pediatric Diabetes Network, and I can attest to how passionate they are about this work and supporting children and families. So it's really nice to sort of see the other end of this. Just before we wrap up, I know we don't have a lot of time for questions, but we will send an email afterwards to everyone who attended with the resources that Heather mentioned. And just if there are a few questions, if anyone wants to put them in the chat or the Q&A, we can do our best to address them in the last few minutes here. And I just want to also share my screen to say thank you so much for attending. Thank you again to our speakers. And we really hope that people can fill in the evaluation survey, so that will be sent to and also in the chat. And then if you have any questions or comments, you can reach out to myself or Maria. And just a reminder about our upcoming events. And yes, Marie has put in the chat the link to the evaluation survey, and a reminder that this webinar is recorded and will be posted on the PCMCH website in the coming week or so you can find it there. And yeah, if there's no questions, we'll give everyone back a few minutes of their lunch. I don't see any questions, but again, we will share the resources from the Diabetes Hope Foundation. And again, thank you so much for sharing your expertise and your experiences. I think this is really valuable for everyone on the webinar today. And we will look forward to learning, I think, more from the work that the Diabetes Hope Foundation is doing in the future. So thank you so much for joining us this afternoon.
If possible, can I just add one more quick thing? That
Yeah.
the one thing with the Diabetes Hope Foundation is that there's so many different points of entry that I know David got a mentor and he loves it. He is now a mentor, but there's so many different points of entries for families and for students to get involved in so many different ways. And thank you for letting us have the opportunity to share today too.
Thank you so much.
Stephanie.
Right, I'll leave it at that. I think you can stop the recording now, Maria. Thanks so much, everyone. Have a good rest of your week.